Hi, I'm Dr. Ron Gardner. I'd like to talk to you a little bit about osteoarthritis care. Now, we primarily deal with osteoarthritis of the knee, and a lot of these remarks will be specific to the knee, but it's actually fairly generalized to shoulder, hip, knee, some other areas of osteoarthritis as well. Very specifically, there are two main areas of osteoarthritis care. There's surgical, or what we call operative care, and there's non-operative care. Now, the operative care, it pretty much falls into two categories. There's arthroscopy. Now, for true osteoarthritis, arthroscopy has very limited benefit. For people who have minor osteoarthritis, but also have like a cartilage tear or a labral tear in the shoulder or something like that, then sometimes arthroscopy to remove those torn pieces or maybe a loose body has great benefit. But arthroscopy for the purpose of just cleaning up an arthritic joint has very limited value and has not been shown to have great success in the past. The operative procedure for osteoarthritis is usually joint replacement. Now, joint replacement for the shoulder has a less attractive success rate, but is very good for pain relief. Joint replacement for the hip has excellent pain relief and an excellent track record. Joint replacement for the knee, which really should be called resurfacing now, not joint replacement, has an excellent outcome and a great benefit, but also carries with it significant attendant risks, and it's a big operation and a big recovery. That's why a lot of people, and most people in fact, would rather try non-operative care first. And of course that makes sense. There are both invasive, non-operative ways to treat it and non-invasive, non-operative ways to treat it. We're going to call those true conservative methods of care. Now, you're already aware of some of those non-invasive, non-operative, or what we call conservative care methods. They are weight loss, activity modification, use of over-the-counter medications, both anti-inflammatories like Advil for ibuprofen, or for naproxen you use Aleve. But in the non-anti-inflammatory group of conservative medications, there's also acetaminophen, or Tylenol as you would know it. Now, we also can give you prescription strength anti-inflammatories or true narcotic medications. Non-medically, there's physical therapy, there's bracing, activity modification, and sometimes there are other techniques such as topical use of anti-inflammatories as well. Now, if you want to go to invasive non-operative techniques, those are almost all injection therapies. There is steroid injections. People commonly refer to this as a cortisone injection, but we don't really use cortisone anymore. We predominantly use dexamethasone. It has fewer side effects and has the same beneficial effect. In the other injection therapies, there's viscosupplementation. If you'd like to know more about that, we have another video about that goes into much greater detail. The injection therapies we've talked about before now are masking therapies. They help the joint to feel better, but they don't really heal anything. There are two types of injection therapy that actually promote healing. The first of those is prolo therapy. Now, there are a lot of different products out there. There's Serapin and there's sodium maruate, but of all the products that are used for prolo therapy, the one that's just as good as the others and the simplest is a complex concentrated sugar solution. And that's what we use. It's a high-density dextrose injection into either a joint or into a bursa or a soft tissue problem. It's called prolo therapy, as short for proliferative therapy. It helps to bring a non-destructive inflammatory process to the area to actually promote healing by bringing in extra blood flow. We have a separate video for that as well, just like the viscosupplementation, if you'd like to learn more about that. The final invasive but non-operative therapy for osteoarthritis are what we call these cellular therapies. Now, for people who have mild osteoarthritis, but who have not benefited enough from the other non-operative techniques, we can use simple platelet-rich plasma therapy. Now, we have another video about this if you'd like to have more details about it, but it's pretty much reserved for people with mild osteoarthritic changes. Now, none of these cellular therapies are covered by insurance by and large because they're so new. But for people with more advanced osteoarthritis, we need to go to a true stem cell therapy. There's two different forms of that as well. For younger people with osteoarthritis, younger means less than 40, we can use bone marrow aspiration, which we do right here in the office under local anesthesia. And by taking the bone marrow contents through an aspiration, we can concentrate the stem cells and the nucleated cells out of that and put that back into the arthritic joint to hopefully repair and possibly even grow a new healthy joint surface. Now that still has to be stimulated from the growth factors that come from the platelets of the platelet-rich plasma therapy. For the people certainly over 50, but for most people over 40 even, the bone marrow stem cell numbers, which begin to drop with age, aren't as rich as, if you can believe this, the stem cells that come from fat. So we actually, also here in the office, under local anesthesia, can do a mini liposuction. Now it's not enough to give you a contour change or a weight loss, but the liposuction that we do under local anesthesia is about 1.5 ounces of fat that we also then centrifuge down, take out the stem cell rich layer of the fat, and inject that back into the arthritic joint. Now it also has to be stimulated with the growth factors that come from the platelets from the platelet-rich plasma therapy. For either of these techniques, we would bring you back in about a month and do a second platelet-rich plasma therapeutic injection called PRP to continue the boost of these stem cells that have already been installed. The bone marrow aspiration or the liposuction do not need to be repeated at that time. I hope this discussion of operative and non-operative techniques for treating osteoarthritis has been helpful. Whichever path you choose, if you fail the non-operative approaches, we always have the operative approaches to fall back on. Now, we have an opportunity to discuss any of these techniques with you if you would choose, and we thank you very much for your time here today.